Hello everybody, my name is Ricardo Garcia from Mexican Social Security Institute in Mexico City, Mexico, and I'm going to present you our study, Demographic Poor Prognostic Factors in Mexican Patients with Multiple Sclerosis. Multiple sclerosis is the main cause of non-traumatic disability in young people. There are many prognostic factors which predict long-term disability progression, like smoking, gender, and age. Being poor prognostic factors, smoking patients, male gender, and age older than 40 years. However, in our population, there are not such kind of studies. The objectives of our study was to establish if age, gender, and smoking are long-term disability prognostic factors in Mexican population. We carried out an observational, analytic, cross-sectional, and retrospective study at Neurology Service in Specialties Hospital at Siglo XXI National Medical Center in Mexico City. We took the information from medical records of hospitalized patients from January 2017 to January 2020 with new MS diagnosis, getting the proportion of patients with EDSS greater than 2 by 6 months of diagnosis, the frequency of smoking, male gender, and older than 40 years, performing chi-square. 75 patients were diagnosed, but only 73 completed the 6 months follow-up. Male gender were 37 patients, and only 10 got an EDSS greater than 2 at 6 months. Older than 40 years were 21 patients, and only 7 had an EDSS greater, and smoking patients were 23, and only 10 got an EDSS greater than 2. The probability of getting an EDSS greater than 2 in each group was, by male gender, an odds ratio of 1.39, but a p-value not statistically significant. From older than 40 years, an odds ratio of 1.86, and also a p-value not statistically significant. And smoking patients got an odds ratio of 2.89 and 95% confidence interval of 1.32 to 6.34, and a p-value of 0.007. So, of all the prognostic factors evaluated, only smoking predicts poor disability in our population. Despite male gender and age older than 40 years have an odds ratio greater than 1, they are not statistically significant. However, further studies with a greater number of patients are needed in order to prove these results. Have a nice day.